Hey guys, Dr. Justin Marcagiani here. Today we're going to be doing a quick video on how I use my percussor massage gun, the Theragun Pro 4th generation, to heal injuries faster and recover faster. Really excited. I've done a video before on this topic. We'll put a link here or there where you can find a previous video, but I'll just kind of do a fast review. I'm recovering from a bicep tendonitis injury, and I'll just kind of walk you through my thinking and kind of how I try to accelerate healing on the natural side. When you have a tendon issue or a ligament issue, the problem with these tissues, they don't have a lot of blood flow. And that makes it very hard to stimulate healing. And as you get older, your muscles, your tissue needs more pliability because it's very easy to tear beef jerky versus the nice soft beef tenderloin. Beef tenderloin's like a sponge, it can absorb force. Beef jerky can tear and rip. And so as you get older, it's important that you have good routines that help incorporate pliability into your muscles. And so you can do foam rolling, you can do whole body vibration, and percussive therapy is an awesome tool. So this is my percussor. It's a Theragun 4th generation. The 4th generation is probably the best bang for your buck. It has the ability to change the heads, the angles, which is great. If I do my bicep, I want it at this angle with a little triangle here. Come right in. I can work on the tissue here like so. The excellent thing is if I'm doing, let's say, my back, I can change the angle here. Let's say I'm doing my hamstrings. I can have this angle like this and come at the hamstrings. I'm going on the quads all the way down, and I can grab it here and then work on the quads, let's say the back like that. So it's cool having the different angles, especially if you're hitting different parts of the body. So it really optimizes self-care so you can really hit that up. Now, anytime you have an injury, I use a lot of ART as a chiropractor. I used to, and I was doing more physical, seeing more patients physically, where we'd find these tissue adhesions. And we'd always go above and below the joint because a lot of times if the injury was very chronic, there could be compensation patterns in that joint that's having to work harder because the joint above or below is not working well. So we always factor that in. If the injury is more acute, like this injury was more acute from basically I had a cable pulley up here and I was trying to pull that pulley down so I could do a decline cable press. And it was this kind of curling motion and bringing it up that injured it. And so I like to mimic this lengthening here. So what I'll do is I'll come here and then I'll actually lengthen to that exact position to shorten and then lengthen that tissue. And I'll go, because bicep tendon, you have the medial tendon that goes up in here like this. It's the short head. And the long head goes up to the bicipital groove. And so that's the lateral or long head, and the medial head is the short head. And so in general, there's a couple frequencies. There's 1750 times per minute to 2400. I typically start at 24 at the lower frequency because it penetrates deeper. And also I love the battery here comes out, and I have two. So I have one hour always charging. So if it dies or I get low, I just swap it out typically every week. I just give it a fresh battery, which is nice. The newer 5th gen, it's like $200 more. You don't get the second battery. And the only difference is it's a little bit quieter. There's a little bit of a Bluetooth feature to it. It's not that much difference at all, but the extra $200. All right, so how I'll work on my tissue is I'm going to work on shortening and lengthening. And the goal is this. We're trying to work on the pliability, getting the tissue more pliable, so when I move it, it's going to be able to absorb force better. I'm less likely to injure it. It's also going to help bring blood flow in there, which is going to help with tissue healing, oxygenation, nutrition. And the goal of me working through that belly of the muscle is we're trying to loosen up that fascia. So the fascia is going to be, if this is my skin, my shirt is like the fascia. And imagine you get sweaty and like your shirt sticks to you and you can't get it off. Well, when your tissue gets injured, that fascia sticks. And when it sticks, it almost prevents good blood flow and oxygenation from happening. And so we want to break that up, kind of like taking your shirt off after you're sweaty. You can like kind of dry off kind of thing. Well, this allows your muscles to be able to get better blood flow and better heal. So it's really important for healing. And so I'll do a lot of shortening and lengthening. So typically I'll walk you through my routine in general. And I just do one cycle on the lower. So this is 1750, you can see there. Okay. And I'll grab it like this. And so the first thing is the origin of the muscles up here, the insertions down here. Never was pain at all down here, but I'll just start at the very lower end of the muscle. And I'll just work it up. Never any pain, but it's always good just to make sure, I reset the motor neurons there so the tension is low. Because you don't want to have that muscle be inflamed just because the tension's really high. So if you can reset those alpha motor neurons, then the resting tension's lower. It's like having a guitar string and you turn it down an octave, if you will. Kind of like that. So now I'm just hitting this bicep tendon here. And I just do just nice little circular patterns. So now this is the bicipital groove right here. And I'm going to do nice circles over that. And I'm using the medium head. I'll show you the head options in a second just so you guys can see it. So now I go right into the pec minor here. So I'm going to work a little bit into the pec minor going into that bicep area. And right now, I just call this mowing the lawn. I'm just helping the pliability here. That's all I'm doing. And then now I'm going to start doing some motions. And now I'm going to start doing some myofascial. So I'm literally sweeping across this whole tendon. So I'm starting right here and I'm sweeping across. So I'm shortening and then I'm lengthening. Shorten and lengthen. Shorten, lengthen. So I'm majorly just hitting the lateral bicep head right here. And now the short bicep head. The short one goes into that coracobrachialis. It inserts there. The long goes right into that bicipital groove. And I have a little tool to get in that bicipital groove. I'll show you in a minute. So short, long. And then now I'm going to go here. And now I'm going to lengthen. This is how the injury occurred. So I'm getting into that lengthening position. And then now I'm going to shorten, lengthen. Now it's at length. Shorten. Now it's at length. Now I'm going to do a little bit of chest. Pec minor into bicep. Pec minor into bicep. Pec minor into bicep. And just a quick little head option here. This is the medium head. There's a softer version of it. I call it the clown nose. It's like a big clown nose. Okay, so here's your bigger clown nose. Here's your medium clown nose. I like that one the best. This is the thumb right here. That's good. That would inflame it a little bit sometimes. It would get in too much. This is if it's really inflamed or you're just trying to do some fascial flushing, it's very spongy. And this is if you're really getting into like tendons and things like that. But I find that creates a little bit too much inflammation at the tendon level. And then I have my wedge. The wedge is excellent. So now I'm going to do that, and I'm going to just try to get it right into the bicipital groove. So that groove, if you feel it, that tendon sits right here. So I'm going to just basically line this bad boy up like this and just trace it right down that bicep tendon just to get some tissue, that tissue broken down a little bit. So you can kind of feel that groove. It's like right there. So now I'm right at the top, right? And so now I'm going to just shorten and lengthen. Shorten and lengthen. Here we go, right there. And that groove is not a lot of tissue, so it could bounce because there's a lot of, there's not a lot of meat there to hit. So I'm just going a little bit light, and I'm shortening, and then I'm lengthening. I'm shortening, and I'm lengthening. Shorten, lengthen. I'm just getting in that groove. And then now I'm going to do a little transfrictional across. Now I'm going right across it. It's basic transfrictional with that wedge. And now I'm going right up and down, right in that groove, hitting that tendon. And now I'm going to come right across it as well. Same thing. Shorten, lengthen. Shorten, lengthen. Shorten, lengthen. Now, same thing. Now I'm going to increase the intensity. Now I'm at 2,400. So I like to kind of seal the deal with this. It basically just increases the blood flow a little bit more, gets the circulation up, and I'll do similar movements, short and lengthen. I like this because it really helps get the blood flow at the end dialed in, and that you feel really warm afterwards, and it really helps with that blood flow, bringing the oxygenation and that good nutrition in. I'll take some extra omega-3, some extra cod liver oil after this. I got a meal already ready to go. I got some grass-fed meat and some cut up avocados and salsa. See, like that. So shorten and lengthen, shorten and lengthen, shorten and lengthen. Okay. Same thing here, shorten and lengthen. So you can see the general movements are Anytime I have an injury, I work that general area, but then I'm shortening and lengthening in the front, shorten and lengthening here, shorten, lengthening here, shorten, lengthening, shorten, lengthen here, shorten, and I'm doing it twice. I'm doing shoulder flexion extension and then elbow flexion extension. So I'm hitting it in two areas there. So just generally working that tissue, trying to improve length, get some pliability in there, get some blood flow, and really stimulate some healing. Tendon issues can be big. They take a while to heal. And so the only adjunct therapy I would add in potentially if you felt necessary would be maybe some PRP injections, maybe a little stem cell or some peptides that work on some of the tissue healing. But if you get your inflammation down, you figure out the mechanism of injury and make sure you're not repeating that movement, and you have a good device like this, Theragun's good. There's the Brad and Bob have a version that's pretty good too. This is the best because of the 16 millimeters depth and because I think it's about the 60 to 80 pounds of stall force. So I have to put 60 to 80 pounds in for this engine to stall. And that's pretty profound because most I find like 30 or 40, it's stalled out. So I hope that helps. Hope that makes sense to you guys. A couple questions here. Let me dive in. Right chest, pec minor is so bad on me. These massage guns are amazing. Yeah. And so what I would do is I would come in here. It depends on how inflamed it is, right? Come in there with the big clown nose, okay? And then just basically just hit this whole area. Pec minor is going to come in right by the armpit, right in here. And I would just hit this whole entire area. Just, I call it mowing the lawn. You're basically just like you're going outside, you're mowing the lawn, just small little circles, right? Hit the whole area. Go into from your chest right into it. Do a fascial flush. We use flush right into it. And then you can do some shortening, lengthening, do it straight, do it up at an angle, do it down at an angle, right? You can lift up, do a military press and straight down. Hit that entire area there. That's wonderful. Rashawn writes in, hey, Rashawn, hope you're doing well. Do you have any favorite oral hemp CBD supplementation? Yeah, there's one. There's a good product out of Colorado. I think they're called Bluebird Botanicals. That's good. PRP is proline-rich, platelet-rich plasma. Platelet-rich plasma where they spin it out of you take your sample of your blood or your fat cells, they'll spin it out and they'll pull the platelet-rich plasma out of there and they'll inject it back in to drive blood flow and to help stimulate healing. There's also another peptide that's really good that you can inject as well. I think it's even legal at the pro level. They call it the Wolverine peptide for tissue healing. I think it's the HB1, the BPC 157. That helps accelerate tendon and muscle healing. That's another good option. I think that's even legal in the NFL too. So, or maybe it is banned. They're saying it's banned. I thought it wasn't banned. Currently, it's experimental, limited studies. Yeah, I don't think it's banned though. But that's an interesting peptide to use. But either way, right? You can always do platelet-rich plasma. Is a good starting point, not too expensive, and that can stimulate good healing. But again, either way, you have to reset the muscle tone. You have to reset the tension in that muscle, and you have to make sure you get to the root cause. Then also, you want to make sure that you're really helping the muscle tissue improve pliability and work and function and glide over that fascia. And then if you do these adjunct therapies, then you do it on top of that. So you get to the actual root cause. Any topical estosome products that you help with this? Not that I'm aware of, but I mean, not totally. I mean, outside of like maybe topical red light, I think that's good. PRP stem cells, you'd have to check they have local clinics where you could do that. Just put your area in there, Rashawn, and just put like PRP or stem cells per your area. You can definitely get PRP locally. Sometimes stem cells are state specific based on regulations, whether some will just do stem cells from yourself. They'll take it out of your hip, or some will do like placental, or some will do like foreskin. It depends on the state. Some will even go down to, is it Peru or Panama? Panama, I think. And they do them down there. And then collagen obviously is going to be really important for connective tissue to really help strengthen it. So 20 to 40 grams of collagen a day, especially if you have an injury, keep it to that 40 side. Yeah, after doing collagen smoothies, 4 to 6 bottles, my skin's better. Yep, that's great. Yeah, to improve skin quality, I'm also a big fan of using some emu oil. Make sure it's AEA certified, so you know it's getting the real deal, not a bunch of cheap canola oil. But emu oil is wonderful. Muscles are strong. Yep, that's good. Excellent. Well, very cool. Hope you guys enjoyed. I put a link to the actual Theragun that I have. The 4th generation is I think your best bang for your buck. It's got the 16 millimeters of depth. It's got the double battery, and it's got the stall force of the 60 to 80 pounds, which is key. So it's the best one out of all of them. I've owned a bunch of these. I have a $2,000 one by Erconia over there, and this thing I mean, this thing, that can't hold a candle to this because of the portability, the ability to adjust it, but also the 16 millimeter depth to get that to go deep into the tissue is incredibly therapeutic. All right, guys, hope you enjoyed today's video. If you did, comments down below. Appreciate it. Take care.